So my name is Annette Jansen, and I am a surviving spouse of St. Charles Police Officer Grant Jansen, who was killed in the line of duty in September of 2008. Through that organization, through that experience, I became aware of Missouri Concerns of Police Survivors. Concerns of Police Survivors is a national organization, but then each state has their own chapter. And we're made up of all volunteers who are all survivors. It could be parents, siblings, coworkers, spouses, children, adult children. And we just basically support each other emotionally. We have retreats all throughout the year for those different categories. We respond to line of duty deaths all across the whole state. So when there is a line of duty death, we respond and immediately help them within like 24 hours of the actual incident. We help them through the funeral. We help them get to police week. We help them with other memorials and just be there for them emotionally. So it's a little different than Backstoppers. Backstoppers is just here locally in this region, whereas COPS is a national organization, and Backstoppers does financial, and we do more of the emotional side.
If you could offer some tips to first responders out there right now in terms of what they can do proactively to ensure that if the worst happens to them because of this virus, that their family is going to be able to get the benefits, what do you think first responders should be doing now?
I think, for one, I think they should really be even more careful about limiting their contact when they're off duty, because that is going to show that most of their contact has been made while on duty. So limiting that contact, not even just for their own health or for their family's health, but just to show that the majority of their contact has been made on duty. That way, if something should happen, they can say, that it's more than likely, which is all that public safety officer benefit is requesting, that it's more than likely that it occurred while they were working. So limiting their contact off duty, and then also just documenting every single thing that they do, and not even just on duty, but documenting what they do off duty so that they can see, if they can see that there is less contact and less likely of a chance that they caught it when they were off. So those are the main tips that I would do. I mean, I would hope that the department heads are also, if for some reason you believe that you came in contact with somebody who may have had it, reporting that right away to your supervisor and to the department head to make sure that that's also documented.
There are other illnesses that have been considered line of duty deaths, but the process to prove that it can be lengthy. So what you're saying right now is that first responders have to be proactive. They have to keep track of what they're doing and really, unfortunately, minimize contact with their own families as much as possible.
Correct. Yes. And I mean, here's an example. We had a line of duty death that involved an accident that he was out of work for some time following the accident, and then he returned to work. And then shortly after that, he ended up dying.
Wow.
And it was like over an 8-month period. And so they had to prove that. And it was all based on documentation. So they had to prove that the accident, the complications that he suffered 8 months later or whatever were directly related to the accident that he had in order for it to be line of duty. So
and the accident, of course, was on duty.
Yes, correct. The accident was on duty, but the death occurred so much later. They had to prove that there was a correlation between his death and the actual accident.
Wow.
And we've had other incidents like that where people have been shot and they live, and 20 years later,
right? Yes,
they come to the injuries. They have to prove that those complications were, related directly to that in order to receive those benefits. So there's lots of incidents where it has to play out, and it really comes down to documentation. documenting all the hospital stuff, your doctors and who you visit. I mean, every single thing you can think of, even if you think it's trivial. I touched the gas pump here on this date at this time. Write everything down, just because you just don't know if that could be the piece that they're going to be looking for.
Absolutely. And that's got to be stressful on officers' families or first responder families as well, when something like that happens medically and you have to go through all this process and you have to prove it and you have to wait, and that's got to be very stressful, on top of losing your loved one. How has that gone so far for the people you know that have been through that?
It is extremely stressful. I know in my case, my situation was pretty cut and dry, and so I received benefits fairly quickly. But for a family who's struggling and maybe is thrown into being a single parent, or maybe even they were single, it doesn't matter. It's just like, I think there's a twofold here. One, there's a financial piece of it. Two is it's just the validation that what their officer did was
Right.
a sacrifice. And I think it hurts some families who've not received it when maybe they should have received it, but because the documentation was not there, they
Yeah.
didn't get it. And it feels like a slap in the face because they feel like their officer's sacrifice was not validated. And that, so it's two piece there. It's not even just about the money, but it's about validation.